Hello everyone, welcome. Thank you for joining me. In this session, we're going to focus on planks. I don't typically emphasize planks for the general population because there's so many issues people have with their external extremities, like their shoulders, elbows, wrists, toes, feet, and ankles, that planks become a bit hard on a platform like this. That being said, they can also be really helpful for people who don't have issues with that. So I don't want to avoid them completely. If your extremities, your distal ends don't feel good in planks, you can always come on to a less distal part, so like your elbow. So if you're good from your elbow to your shoulder, try the plank series on your elbow. It will become difficult when we come to a reverse plank that is going to be aggressive, right? We can also have one leg long and do a smaller lift, and I will show these modifications as we go along, right? So again, if your fingers, palms, wrists bother you, you can be on your elbows. Now, if from your elbow to your shoulder bothers you, planks are just not going to be the best modality for you, at least on a platform where it's just a home-based thing. You can go to a Pilates studio to help you with that sort of support. They have much more equipment there that can help support your joints so you can get your torso to have more strength. Planks are great because we are resisting gravity. Mostly it's about your torso resisting the pull of gravity. So that sense of constantly pushing your body away from the floor, resisting gravity, getting that torso to move away from the floor is a big emphasis. That's a lot of talking. I don't usually talk this much. Today we're going to focus on 3 sets, holding each plank for 20 seconds. So we're going to do a forward plank, side plank, and a side plank on the other side, and then a reverse plank. And again, you can always be on your elbow to make it less intense. You can also always be on your knees in case that's not completely obvious as well. So let's get started. I'm going to show the first variations, which will be on your elbows and knees. All right, so here we go. You're just on your elbows and knees in this nice long position from your head through your shoulder to your ribs, hips, and knees. The goal here is to keep the hips away from the floor, right? They can be higher, that's fine, but just away from the floor. So if holding them in this long line doesn't feel good to you, just get those hips higher. That'll be a bit easier because because the hips come directly more over the knees, and that's an easier place to support yourself on. All right, so let's all do this together. If you want to do it on your hands with knees down or up, that's your choice. Here we go. And here we go for 20 seconds. Here we go, that's right. Yeah, see, it's not so bad. And again, really push your body away from the floor a lot. That does include your head. So try not to let your head drop down because you're trying to push your body away from the floor. That doesn't mean look forward directly either. Just look down at the floor between your arms. You're almost there. You're almost done. And that was 20 seconds. Great job. Now, we're going to be on our side elbow here. And here the emphasis is pushing the floor away with that arm and the bottom side leg, right? This top leg could be straight or bent, right? You're going to have the hips up. If that is too easy for you, you can straighten both legs. But for right now, we're just going to have the knee bent. Here you go. When you're ready, up you go. Press. And again, push the floor away strongly. Make sure this shoulder doesn't suddenly creep up to your ear. Push down. This other hand could be on the floor to give you some assistance, or it could be on your side. This top foot can help push the floor down as well to get those hips to drive up. Let your chest and eyes look forward into space and then come back down. You got it. That was 20 already. See, it's not so bad. Let's go the other way. All right, knee is bent forward, other leg long. Push the floor away before the hips drive up. And ready, here we go. Up you go. Easy. That's right. Push the floor down strongly. Push. Again, this top foot can push. Bottom knee and foot are pushing, as is this top shoulder. Top hand can always be on the floor to make it more assistive to you, right? Push strongly. Make sure the hip and ear don't slowly collapse down to the floor. And then gently come down and rest. Really great job. Now we have our reverse, and this one may take a little bit of talking through here. So if you're on your elbows, which I said we're going to do the first round just to demonstrate it, I recommend you have one leg bent, other leg straight. Right? You can have 2 legs bent and press the hips up here. That is just a bit more aggressive for your neck than this smaller lift here. Right? We're going to hold this for 10 seconds and then switch for 10 seconds. Yeah, you ready? Here you go. Push up, breathe deeply. Oh, it'd be helpful if I started. 8, 7, that's right, 6, 5, 4, 3, 2, switch your legs. Great job. 10, push. 9, push the floor away from you. 8, 7, good. 6, push. 5, great. 4, 3, 2, you got it. Rest. Excellent work. Right, alternatively, you can have your hands straight and knees bent, right? You can also do one leg straight as well for the rest of the series. Now, let's go back to facing forward. We're going to do it on straight arms with knees down. Ready? Otherwise, go back to your elbows. Here we go. Easy breathe. And again, you're pushing the floor away from you. And again, the hips can be higher. That's fine. They just don't get to go lower than the line of your knees and shoulders. Again, make sure your head's not dropping down. Reach the back of the skull towards the sky. Bring your chin towards your chest a bit. You can see it's not that difficult, and you can do it for probably longer than 20 seconds. But right now, we're going to be done with that. Really great job. Let's come on to our side. You can be back on your elbow here, right? That's totally great. Otherwise, the arm is straight and you're pushing the floor away. Fingers face, whichever works best for you. But think of screwing a lid on so the fingers rotate away from you. Even if it just doesn't move the hand, you're going to rotate to push. That can help you some, so long as it doesn't strain your joints. I've talked a lot. Here we go. Up you go. Breathe deeply. Push, 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 push. You can play around with that hand as you go along, right? Maybe you need to rotate those fingers out a little more to make yourself more comfortable. And again, try not to let your head drop. Push the floor away with the feet and that bottom knee. Breathing. Push the floor away. Make sure the shoulder doesn't collapse up towards your ear or ear down towards your shoulder. And then rest. Excellent job. Other side. Here we go. Right? Again, if you tried it with straight on one side, try on the other side. Again, rotate the arm as far as you feel comfortable with. And even when you're up there, think of that slight rotation through the arm bone. Can help give some support. And again, here you go, up you go, push. That's right, push, 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 push. Push the floor away from you. Reach the crown of the head out long, eyes and chest forward, out into the darkness, right? 2 feet pressing, bottom knee pressing, breathing. The shoulders not reaching up towards your ear. You're pushing the floor down quite strongly, driving the body up and away, and then gently release down. Really good job. Now, let's do the reverse. We're going to try with one leg straight, other leg bent. And here, the fingers can face whatever way works best for you, right? Many people prefer the fingers facing away from them. Some people out to the side, some people towards their feet. They're all great, whatever works best for you. When you're ready, up we go for 10 and 10. You got it. Breathe deeply. That's right. Easy. Great. 6, push, push, push. 5, and here your eyes can look wherever's most comfortable for you. You can let your head drop back a bit. That's okay. Switch your legs. As long as your neck is comfortable. I generally recommend people look forward towards their thighs at least. That puts the least amount of tension to their neck and most helpful position for many people. And then bring it down. That was round 2 already done. Now, again, you can always go back to your elbows and knees or straight arms and knees. This last round, we're going to try it with straight arms and straight knees or 2 straight arms, 1 knee down, right? So let me explain that. So you just have 1 knee down in a plank. That's a great way to do it, right? And then you would just switch halfway through, right? For 20 seconds, here we go. 1 long line with your whole body, reaching out to the crown of your head. Push the floor away from you. Keep breathing. And again, it's okay for those hips being higher. They just don't get to go lower, right? Just because it puts a lot of tension potentially to the joints of your body, specifically your lower back. That's not comfortable for a lot of people, right? And then 1 knee down, 2 knee down, rest. And I'm going to go to the side here. Again, rotate the palm as much as you want to, as little as you want to, but a sense of rotation to the arm is going to help you, as if the elbow is going to spin to rotate out, the inner elbow rotates out, or the pointing elbow rotates towards you, right? The part that's bent, that's going to try and rotate towards you a little bit. You can have the knee bent like we did earlier, or 2 legs straight. Up you go. You can also have the top leg forward, bottom leg back. That's easier. Top leg back, bottom leg forward is a bit more aggressive. You can have your legs stacked. It's hard to have this other hand down, but you can have a hip prop in front of you like a tall stool to push down with that top arm to help you as well. Again, try not the hips sag down, right? It's not aggressive on your lower back in this position, but it helps you know where your body is in space and rest. So, in the side plank, It's not as intense on your lower back to let the hips come down towards the floor, but it does help you know what a plank is if you can think of not lowering the hips down, so that when you're in other positions and your hips do drop down, you're well aware of that sensation, right? Push the floor away. You can rotate a little bit this bottom arm as far as you have comfort. Again, top foot forward or back is fine. Legs stacked is fine. Try not to let your body collapse forward. Think of leaning your chest back and projecting your smile out into the darkness in front of you. Really great job. And then rest. Excellent work. Now, we have a reverse plank. We're going to try with 2 legs straight. You don't have to. And I'm going to reverse my hands here, right? It's totally fine to do. It's harder to push with the shoulder blades coming together with your fingers facing this way, but it is very doable. And up you go. Very deeply push. Push the floor away. And again, hips try not to drop down here. Push them up. Feel free to give your knees a little bend. That's okay too. Make sure those shoulders don't float up towards your ears here. You're pushing down, looking over your legs. Push the floor down quite strongly. Push with your legs. Push the heel bones against the floor and then gently come down and rest. Excellent work. So you can see a series of planks is really A, energizing, B, strengthening, C, a foundational component of what people think strength, how people define like fitness and strength to be. And it can be, but it doesn't have to be the only way for everyone to go about it. Right? There are studies that show that holding a plank for 2 minutes, a series of 2 minutes on, 2 minutes off for 4 rounds, can help decrease your blood pressure. So that's another reason to practice planks. You can also practice anything still to help gain strength and integrity to your life, right? So I hope you enjoyed that sense of planks, how to modify them, so long as you have the external limb support that's not compromised or doesn't cause you pain to practice them. Many people, again, have a hard time specifically with their wrists and hands for the plank series. And yes, you can try holding on to bars and things for that, like a weight. A weight would be that. Let me show you one quick, sorry, I'm out of frame for a second. So let's just say you had something to get your hand up off the floor. This often takes a lot of strain off of the wrist and fingers. Now, a weight can roll, so you sometimes add other challenges because the weight becomes unstable. So have something that, just want to give you a demonstration that you can have something that elevates your hand off the floor, will help the wrist strain a lot. People also use fists or knuckles, and I can't really speak to that in terms of a practice that I use with people, just because I often feel that people then put a lot of passive pressure onto the structures of their fingers, like their ligaments and tendons that are hard to heal. Once they get stretched or strained, it's really hard to get them back to a functional position, right? It's hard to have a fist and put pressure on it for that long without the fist collapsing in on itself, and that could potentially over time damage your deep structures that are hard to heal. Unlike your softer tissues like your muscles and some forms of your connective tissue, which heal quicker compared to ligaments and tendons. Ligaments hard to heal. The blood flow is just not really robust there. Same thing for tendons. Tendons heal quicker than ligaments do, but still they're hard because there's a real lack of blood flow compared to the middle of your bone where the muscles are, right? So in the middle of your bones, really easy to heal. Towards the end of your bones where your joints are, it can be harder to heal because those structures don't have the same amount of blood flow that the other parts of the middle of your bone, the soft tissue, that in case the middle of your bone does. I hope that made some sense. In terms of toes, again, it does require some flexibility. So curling your toes under and sitting up on the toes is great, but this is too aggressive for a lot of people to sustain over time. So you can just sit in a chair or even bring your hips up with your toes curled under like that. Right? That's one way to address it. And you can slowly train yourself to sit back towards your heels. You would just put a block here and move the block closer to your heel bone to bring the hips closer to the heels. That would bring the weight directly over your feet and encourage the soft tissue fibers of your feet to stretch. And unlike your feet, unlike your hands, your feet are designed, I don't like the word design. The feet have the capacity to sustain that weight load over time, right? At least in this position, right? We don't have the same structures to support a toenail, oh, we can't see, toenail side and sitting down. We don't have the same deep structural support on the top of our foot like we do on the bottom of our foot, right? So having the capacity for this is more innate to how our body works than having the toes curled under the other way. Now, you can have the top of the foot down, right? We tend to have an easier time with that position, but that's a different, we don't do a plank on the top of our foot, that's all I'm trying to say, right? So unlike our wrists and fingers, supporting ourselves on our fists is difficult because the structures are going to collapse because I'm not holding on to a bar per se. So that's one way to go around that, would just be hold on to a bar and then put your knuckles down, as long as the diameter of whatever you're holding on to allows your fist to hold that same shape. That is a far better way to go using your fists on the floor versus just nothing to hold on to. When there's nothing to hold on to in your fist, those deep structures get compromised, right? Because it's difficult to push your hands out in this fist position. That would be the activation part of the deep supporting structures, right? Because the fist is getting curled in, curled in, curled in without holding on to something in the middle to stop it from collapsing. Right, so if you have this is a really bad example, if you had just two wooden dowels that were the same diameter that were solid and aren't going to collapse, when you take your fist onto the floor holding those dowels, that's a better way to support your joints, at least for your fingers and stuff, because the pressure of your body is getting transferred to the dowel and not just to the fist and your fingers. That was a lot of talking. I'm not sure if that was helpful to a lot of people, but maybe to some. So fist for a little bit, fine. Holding planks with fist, don't highly recommend it for the reasons we just discussed. And their toes can be worked on as well, as long as you're focusing on a gentle stretching of the bottom of the sole of the foot through the bottom of the toes, right? You don't want to have your toenail side back and sit. Our structures don't respond to that pressure over time well. Oh, that was a lot. My name is Eric. This is Nucleus Strength. I look forward to getting stronger with you in the future. Yours in good health. Take care.